Now that we've developed an ability to co-contract at the knee in standing, we've done that statically in a controlled manner. And as we start the movement, the patient's going to do this with a top-down strategy. They're usually going to be quite slow. And then as we start to speed it up, then they'll be able to maintain that ability to co-contract at the knee as they go through the movements a little bit quicker. Whereas if they try to do it too quickly at the start, they just won't be able to co-contract at the knee. So that leads us nicely now into starting to go to more dynamic co-contractions. And that's where we're going to start to use some of our lunge progressions now to reinforce the nice movements that we've already done in terms of allowing the opportunity to train a co-contraction with good midfoot, challenge our base of support, but at all times manage these perturbations outside of higher center control. So the last few progressions, we were using a lot of top-down cues in terms of squashing an orange through the midfoot. So what we want to do now is we're going to create some movements where the speed of movement is so quick that we're not really going to have time to think about squashing oranges. So this is the pivotal point where we're moving away from top-down cues to starting to move now really towards thoughtless, fearless movement. And we're starting to really stimulate the tissues at a spinal cord level rather than using a top-down cue such as squashing an orange to push the floor away. So the big thing with the lunges that we focus on here is these aren't lunges like you do in the gym to build strength and to build eccentric stimulus. What we want to do with these lunges is we want to train the ability to utilize elastic energy. So again, just like with our hopping progressions, as the foot hits the floor, we don't want to sink, okay? Because when we're walking from one step to the other, we don't want to sink and waste an opportunity to utilize elastic energy. So with our lunges, the first progression that we're going to do is we're just literally going to start on our left leg and we're going to step onto our right leg and find our midfoot. Now, that looks so simple, but for so many patients, it's going to be so hard because remember what I said, they don't have an awareness of the midfoot. So the ability to stand on left leg, go onto right leg and allow your base of support to be challenged and get your center of gravity into the middle of your base of support, that for a lot of people is very, very difficult. Now, Shane, if you just do that for us, and that's ultimately all we're looking for. Now, again, Shane, because we teach this stuff day in, day out, we're quite, I suppose, finely tuned in finding that midfoot. We've got a good awareness of that. But for your non-sporting patients and even your sporting patients, they will really struggle with that. Okay, so again, it's the ability to step onto the midfoot. Don't lose height. Okay, because again, if you lose height, you're using your quads to eccentrically control. You're putting the hamstring in a poor length tension relationship. And again, we're eccentrically loading through soleus as well. So again, we want that good intent. We want a contraction through soleus, work isometrically, not eccentrically, okay, which is going to allow the hamstring and the quads to be in better length tension relationship to co-contract. And then ultimately that sets us up for success for the next step. So that's what we're going to refer to as our lunges. I like to call them elastic lunges in the mentorship because ultimately we're setting your body up for success to utilize elastic energy.